Hi, everyone, and welcome. My name is Meg Berry, and I am the Director of the Division of State Coverage Programs in the Children and Adult Health Programs Group in the Center for Medicaid and CHIP Services. Thank you so much for joining us today for the first stakeholder information session for the Connecting Kids to Coverage Healthy Kids 2022 Notice of Funding Opportunity. I am going to walk through today's agenda and then turn things over to our speakers. But before I do that, I have a few housekeeping items. The webinar today is being recorded and it will be posted on InsureKidsNow.gov. Also, while members of the press are welcome to attend the call, please note that all press and media inquiries should be submitted using our media inquiry form, which may be found at cms.gov/newsroom/media-inquiries. All participants will be muted throughout the call. Closed captioning is available via the link in the closed caption window on the bottom of the screen. We will have time to answer some questions during the second half of the call. Questions can be submitted using the Q&A function on Zoom. And questions that come in after today's call can be sent to healthykids@cms.hhs.gov. Everyone should be able to see today's agenda on their screen. We'll start with some opening remarks from Deputy Administrator and Director of the Center for Medicaid and CHIP Services, Dan Tsai. We will then have a series of speakers from the Connecting Kids to Coverage grants team to provide an overview of the funding opportunities, project activities and data reporting requirements, and application review information, which includes the selection process. These presentations will be followed by a question and answer session where we will address some of the questions submitted through the Q&A function. And with that, I will turn it over to our Deputy Administrator and Director of the Center for Medicaid and CHIP Services, Dan Tsai. Dan?
Thanks, Meg. I will be brief. This is one of the more exciting phone calls to get to do in the midst of a day. I think the team is very excited about this opportunity, and I hope you all are as well. So thank you all for joining us. As you know, and you're on this call, we as an administration have committed a record close to $50 million for the Connecting Kids to Coverage program for this year. And it really reflects our deep commitment to coverage and access, to equity, and to improving health for kids and others along the age continuum. So there are just three things I wanted to note as we get into pieces, and you'll hear a lot of very important information from the team and some of the Q&A that Meg mentioned in the agenda. So the first is just continuing to call attention to the fact that coverage gaps continue to exist and coverage disparities continue to exist. And that's really what we are trying to tackle here. So the numbers are relatively astounding still at this point. We have close to 4 million, a recent study, we have close to 4 million uninsured kids in the country, 2.3 million of which are likely eligible for Medicaid and CHIP. That's an astounding number. And the disparities from around uninsurance are also stark. So American Indian and Alaskan Native children have the highest rate of uninsurance at close to 12%. That's close to 1 in 8 kids being uninsured. Hispanic children, the uninsurance rate is 11.4%, and Black/non-Hispanic children at 5.9% uninsurance rate. And so we are actively encouraging organizations that serve kids in diverse and underserved communities and hard to reach communities and others, really to help us collectively stack hands together and tackle some of those coverage gaps that we all feel deeply passionate about. Second, we are affirming through continuing to affirm through the Connecting Kids to Coverage grant our belief in culturally competent, local, and trusted resources as a part of helping to engage and enroll and support kids and individuals in getting onto coverage. And so much of the spirit and why the Connecting Kids to Coverage grant piece is so exciting is that we can partner with, encourage, and provide funding to folks on the ground who will be able to reach communities that we couldn't otherwise support, And so we are excited about that, and we're actively encouraging as many folks who have expertise in a range of different organizations that I think are participating on this informational session to really be able to participate and to apply, and hopefully to be able to support some of these efforts. So that is a really key tenet underlying this. And third, we also wanted to note one important change for the first time this year in the Connecting Kids to Coverage grant piece is that we are including as a target populations pregnant individuals. And so we're encouraging potential grantees to be able to support not only kids and parents, but also pregnant individuals. That very much supports a body of research around when and how to get and help support kids getting into coverage. It really supports birth outcomes, prenatal care, and much of the postpartum pieces that target a lot of the equity discussions that we're having more broadly in CMS. So those are just three things I wanted to note. Again, we're excited, the team is excited, and thank you all for joining, and we hope many of you step forward. So I think I'm going to turn it now to Janice.
Great, thanks, Dan. I would like to provide a brief background and overview of the Healthy Kids Grants, new changes and key dates. If you haven't already, I would encourage you to have the NOFO in front of you, as we will be referencing some page numbers throughout the presentation. As background, the Healthy Kids Act provides $120 million for activities aimed at reducing the number of children who are enrolled, but not enrolled in Medicaid and CHIP, and improving retention of enrolled children. Of the total $120 million in funding, 10% is allocated for outreach to American Indian, Alaska Native children, 10% is allocated for the national campaign, and the remainder is allocated for outreach and enrollment of uninsured children and their parents. We have awarded $54 million in Healthy Kids Act funding through 2 rounds of grants to eligible organizations, $48 million in 2019 for outreach and enrollment grants targeting all uninsured children and their parents, and $6 million in 2020 for outreach and enrollment grants targeting AIN children and their parents. To date, CHIPRA, the ACA, MACRA, and the Healthy Kids Act has provided the Centers for Medicare and Medicaid Services $216 million in grant funds to over 294 eligible entities, which include community-based organizations, states, and local governments to support the enrollment and retention of eligible children in Medicaid and CHIP. This funding has been dispersed through 5 cycles of grants that were broadly targeted to eligible but unenrolled children, and 4 rounds of grants that were specifically targeted to AIN children. Community-based organizations typically have access to and credibility with low-income families in their communities, making them indispensable partners for carrying out specialized strategies to target the hard-to-reach children who remained uninsured. State and local government agencies also play a critical role in helping to identify and enroll children. They are in a strong position to partner with other local and state-run health and human services programs and agencies, such as SNAP, child care agencies, and WEC, to identify uninsured children and enroll them in coverage. To find out more information about previously awarded grantees, please go to our website at InsureKidsNow.gov under the Campaign Information tab, Outreach and Enrollment Grants. As previously stated, this specific NOFO, CMS commits a record $49.4 million in Healthy Kids Act funding for outreach and enrollment to children, parents, and pregnant individuals. Entities eligible to receive this funding are states, local governments, Indians, tribal consortia, urban Indian organizations receiving funds under Title V of the Indian Health Improvement Act, federal health safety net organizations, healthcare providers, community-based organizations, faith-based organizations, nonprofits, and schools. Please refer to the executive summary on pages 5 and 6, pages 18, 19, and section C1 eligible applicants of this NOFO for details. This year, we also are going to be implementing some new things that we're incorporating for this year's of grants. Currently, grantees target uninsured children with the option to target parents. In this NOFO, we add pregnant individuals as a target population. Expanding to include this population will directly lead to increasing the enrollment of eligible children in Medicaid and CHIP, because generally the infants born to individuals who are enrolled in these programs at the time of birth are automatically deemed eligible for Medicaid or CHIP for 1 year without an application or further determination of eligibility. In addition, increasing enrollment of eligible pregnant individuals in Medicaid and CHIP promotes improved maternal and infant health outcomes. Next, we want grantees to include social media and virtual outreach and enrollment assistance to families in their program activities. The public health emergency has taught us that we need to continue to provide enrollment assistance while being safe and educate families on the importance of healthcare coverage. Many grantees have used social media such as Facebook, Twitter, WeChat, and Instagram to reach eligible families. While grantees generally report that face-to-face assistance is the best strategy to facilitate enrollment in Medicaid and CHIP, virtual appointments will allow grantees to provide enrollment assistance to families who have challenges leaving home, especially when transportation is an issue. Therefore, grantees will need to offer virtual appointments to families. This will be helpful, especially given that people of color have less access to safe and affordable transportation. This is an important enrollment strategy for addressing inequity. Next, we will allow up to 1% of the annual grant award amount per budget period for promotional items and incentives, subject to prior approval by CMS. This information is reflected on page 26 under the budget narrative and page 51 in Appendix 1, guidance for preparing a budget request and narrative under the supplies section. In terms of monthly reporting, in addition to tracking the number of applications, new enrollments, and renewals, we are asking grantees to also track the number of denials. And lastly, regarding new changes, in the last round of grants, we implemented and will continue the 90-day planning period for all grantees. All awardees will be given a 90-day planning period to ensure that needed project leadership is engaged and the identified employees are trained and available to work on the cooperative agreement. We understand organizations may need time to get staff hired and trained. CMS will allow recipients to use grant funds to employ individuals and begin operations at this time. CMS may waive or reduce the 90-day planning period if the awardee's outreach and enrollment efforts, as specified in the funding opportunity and as detailed in the recipient's approved application, are well established with all project leadership, staffing, and support already in place. In terms of staffing, the project director will need to devote a minimum of 50% of their time to grant activities. And as a new requirement, we also want grantees to have at least 50% of the staff hired and trained before the end of the planning period. This information is outlined on page 11 of the NOFO. And lastly, I just would like to remind everyone of the award amounts and some key dates. So again, the funding available is $49.4 million. Grant awards may range up from $500,000 up to a maximum of $1.5 million. The estimated number of awards is 36. A letter of intent is not required. Applications are due by 3 p.m. Eastern on Monday, March 28th. Applications received after this time will be considered late, so we strongly encourage you to submit your application early. The grant period of performance will be for a total of 3 years, starting on July 1st, 2022 through June 30th, 2025. We do plan to issue notice of awards by July 1st, 2022. This information is also highlighted on pages 6 of the executive summary, page 17 of the federal award information, and page 57, Appendix 2, application on submission information. And finally, we strongly encourage you to read the NOFO in its entirety, as some of the most commonly asked questions are detailed in the announcement. Now I would like to turn it over to my colleague, Dietrich Graham, for an overview on project activities, data reporting, and requirements. Dietrich?
Thank you, Janice. I will now go over the program requirements along with data and reporting requirements. Beginning with program requirements, I will be referencing pages 11 through 15 of the NOFO. Starting with project activities. Grants awarded under the Cooperative Agreement will fund activities, strategies aimed at educating families about the availability of free or low-cost health coverage under Medicaid and CHIP, identifying children likely to be eligible for these programs, and assisting families, including parents and pregnant individuals, to apply for coverage. Funds will also support efforts to assist families with the annual renewal process. Applicants are encouraged to consider any of the following outreach strategies, starting with engaging schools and other programs serving young people in outreach, enrollment, and retention activities, bridging health coverage disparities by targeting subgroups of children with lower than average health coverage rates, for example, adolescents, Latino, American Indian, Alaska Native children in rural areas. Establishing and developing application assistant resources to provide high quality, reliable Medicaid CHIP enrollment and renewal services in local communities. Using social media to conduct virtual outreach and enrollment assistance, and using parent mentors to assist families with enrolling in Medicaid and CHIP, retaining coverage, and finding resources for addressing social determinants of health. Grantees will be required to participate in the national campaign activities and adopt strategies promoted by the national campaign. In particular, grantees will be required to work with the national campaign on two special initiatives each year: back to school and year-round enrollment initiatives. Also, any new initiatives focused on retaining eligible individuals in Medicaid and CHIP as states resume conducting renewals after the end of the public health emergency. These initiatives are designed to capitalize on key opportunities for outreach that are expected to be particularly productive. All participants should take these additional factors into consideration when designing proposals. The most effective outreach efforts should link families to direct one-on-one enrollment and renewal support. Providing assistance with online applications and providing renewal support in person or virtually can make enrollment and retention more efficient, effective, and consumer-friendly. The use of social media to conduct outreach and enroll eligible children and families in Medicaid and CHIP. While the emphasis of the Healthy Kids 2022 Outreach and Enrollment Cooperative Agreement remains focused on enrolling eligible children in Medicaid and CHIP, we have found when eligible parents get enrolled in health insurance, their children are more likely to get enrolled and receive necessary preventive care. Appropriate messaging and strategies that help enroll eligible parents can also facilitate the enrollment of eligible children. In past cycles, a number of CKC recipients have also been navigators or coordinated closely with navigators to ensure that a holistic approach is taken to provide coverage to all eligible family members. We continue to welcome applicants that are navigators or coordinate closely with navigators. Families often seek health insurance for their children at times when they are most attuned to needing health services for them, such as when they're sick or injured, need physical exams to enroll in school or summer programs, or need routine preventive care, including immunizations, dental vision, hearing tests, asthma and allergy screenings, or are in search of essential mental and behavioral health services. Organizations and institutions that provide such services, such as hospitals, health clinics, Department of Health, and schools, are in a good position to conduct outreach and help families get their eligible children enrolled. They may also be more likely to have the infrastructure to sustain and track progress of outreach and enrollment efforts. Applicants that are not one of these types of organizations or institutions may wish to consider partnering with one or more of these entities. Parents who have at least one Medicaid or CHIP enrolled child can serve as mentors to parents of uninsured children during the application and renewal process. Parent mentors educate families with uninsured children about health insurance coverage and assist with completing and submitting applications for health insurance coverage. For more information regarding parent mentors, please refer to Appendix 8. I will now cover data and reporting requirements and will be referencing pages 15 and 16 of the NOFO. Recipients will be required to collect and report to CMS data related to their goals and accomplishments for this funding opportunity. Applicants may identify additional metrics that could be used to evaluate the effort of the recipient's work. But the required data that all recipients must report on a monthly basis include number of children for whom an application for health coverage has been submitted, number of children verified to be newly enrolled in Medicaid or CHIP, number of children denied new enrollment in Medicaid or CHIP, number of children for whom the recipient submitted a renewal form for Medicaid or CHIP coverage, number of children verified to be renewed in Medicaid or CHIP, number of children denied renewal coverage in Medicaid or CHIP, and the outreach and enrollment activities completed during each month. The following data must be reported on a monthly basis only if the applicant proposes to target parents with CKC funds. Number of parents for whom an application for health coverage has been submitted, number of parents verified to be newly enrolled in Medicaid, number of parents denied new enrollment in Medicaid, number of parents for whom the recipient submitted a renewal form for Medicaid coverage, number of parents verified to be renewed in Medicaid, number of parents denied renewal coverage in Medicaid. The following data must be reported on a monthly basis only if the applicant proposes to target pregnant individuals with CKC funds. Number of pregnant individuals for whom an application for health coverage has been submitted, number of pregnant individuals verified to be newly enrolled in Medicaid or CHIP, number of pregnant individuals denied new enrollment in Medicaid or CHIP, number of pregnant individuals for whom the recipient submitted a renewal form for Medicaid or CHIP coverage, number of pregnant individuals verified to be renewed in Medicaid or CHIP, and lastly, number of pregnant individuals denied renewal coverage in Medicaid or CHIP. I would now like to turn it over to Sandra Phelps for more information on review criteria and the review and selection process. Sandra?
Thank you, Dietrich. Applications will be reviewed for completeness and compliance requirements as listed in Section D2, Application Content and Format, on page 23 of the NOFO. Excuse me. A helpful application checkoff list located in Appendix 6 on pages 72 and 73 is a great tool to ensure your application is complete. This document provides you with a list of required forms that will need to be submitted, along with the contents for the application and the page limits for each section of the application. Applicants at risk of not being reviewed and ultimately not considered for an award are those received later than the deadline of March 28, 2022 at 3 p.m. Eastern Time, along with applications that do not address all the required topics outlined in Section D2 or do not contain the required documents. Applicants will be reviewed based on criteria outlined in Section E1 on pages 29 through 34 in the NOFO. Applicants may score as high as 150 total points for their overall application, and points will be awarded based on the quality of the applicant's response. There are 6 sections of review criteria outlined in the NOFO. The first section is project narrative, which the applicant may score up to 75 potential points. The project narrative is further divided into 4 sections. The first section is description of need. Applicants may receive a potential of 10 points for this content. This section provides an overview of the need for the grant. Information reviewers will be evaluating for this in this section include a description of the target population, data on the number and/or rate of uninsured children, and enrollment and retention barriers for the target population. Statement of project goals is the next section under project narrative, and for this content, applicants may score up to 10 points. Statement of project goals consist of specifying the measurable goals for your proposed funding in the table provided on page 31 of the NOFO and describing the specific factors you considered to create these goals. The next project narrative section is capacity to implement the project, which applicants may receive up to 20 points. Reviewers will be looking for information regarding the applicant's level of knowledge about Medicaid and CHIP eligibility and enrollment procedures, past experience with conducting health coverage, outreach, and enrollment activities, and the capacity to engage target populations in your community. Outreach and Enrollment Plan is the final section of the project narrative. And in this section, applicants may achieve up to 35 points. Reviewers will be looking for a description of the outreach and enrollment strategies applicants propose using, messaging that will be used to promote, enroll, and retain eligible children in Medicaid and CHIP, and a description of specific efforts the project will undertake during important periods such as back to school time, year-round enrollment, and retaining eligible individuals in Medicaid and CHIP. The next criteria section reviewers will be evaluating is the data collection and reporting plan. Applicants may receive up to 20 points for this plan. In this plan, applicants will need to clearly describe how the required data will be collected and how they will verify the number of new Medicaid and CHIP enrollments, renewals, and denials resulting from your CKC funding. The next section of the application is the work plan and timeline. The applicant may receive up to 15 points for this section. The work plan and timeline section of the application should document activities, reasonable and achievable milestones, and timeframes that are likely to lead to the achievement of stated goals and identify the parties responsible for performing the activities. The budget and budget narrative is the next section of the application, and the applicant may receive up to 15 points for this information. Applicants must provide a budget with appropriate timeline items and a narrative that describes the funding needed to accomplish the goals of the grant. The next application section is the evaluation plan. The evaluation plan is worth up to 5 points. This information will discuss how the project will be monitored during the entire period of performance to ensure that the most effective strategies will be utilized and how the applicant plans to overcome potential obstacles that could impact full attainment of stated goals. The staffing plan is the final section of the application, and this section is worth up to 20 points. Reviewers will be evaluating this section by looking at how the applicant describes the staffing of the project and the review of brief job descriptions and related work experience for the project director and other positions paid under the cooperative agreement. In addition to the listed application criteria, we encourage all applicants to consider when developing and reviewing their applications the following information. Make sure your project goals are clearly stated and appear achievable. The description of need is compelling and is based on clearly cited data. Proposed metrics will adequately allow for project monitoring and measuring project success. The organization has sufficient capacity to accomplish the grant goals. There is a clear plan for verifying new enrollments and renewals, and the prospects for sustaining the project are clearly stated. For the final selection of applications, factors other than merit may be considered for award, including that CMS may assure cooperative agreement awardees represent diversity in project approaches based on key factors such as use of strategies most likely to achieve success and level of need in the project location area. CMS will also consider geographic diversity and scale of all applications when making final award determinations. As outlined in Appendix 5, review and selection process, on page 71, all applications will be reviewed by an objective review committee that may include federal and/or non-federal reviewers. The reviewers will ensure each application addresses the required criteria from Section E1 as the basis of their application evaluation. The results of this objective review will provide recommendations to the CMS approving official based on the panel review and overall application scoring. Appendix 5, Review and Selection Process, provides additional information on how applications will be screened and the review and selection process. Please keep in mind, CMS will do a risk review on all applications prior to awards being made. In the selection process, CMS will take into consideration the following factors: the financial stability of the applicant, the quality of the management systems proposed in the application, and the applicant's ability to meet the prescribed management standards. In addition, please keep in mind that CMS reserves the right to conduct pre-award negotiations with potential awardees. This was a basic overview of the application criteria and the review and selection process. I strongly encourage each applicant to carefully review Section 8, Applicant Review Information, specifically focusing on E1 for the application criteria, along with reviewing Appendix 5, Review and Selection Process in the NOFO. Now I'd like to turn it over to Sharon Jernigan and Dominique Hodge in the Office of Acquisitions and Grants Management to provide additional information on the application process. Sharon?
Thank you, Sandra. Hello, my colleague and I, Dominique Hodge, will give a brief summary of the application process. All application materials are available on grants.gov, and the applications must be submitted electronically through the website. Application submission information can be found in Section D and Appendix 2 of the NOFO. Applications must be submitted electronically through grants.gov by 3 p.m. Eastern Standard Time, March 28th, 2022. Applicants will be able to download a copy of the application packet, complete it offline, and then upload and submit the application via grants.gov website. Search for the CFDA number 93.767 and you will see the NOFO listed there. You'll be able to click on the link to pull up the application itself. Upload early. It is very common for it to take longer to upload your application the later that you wait, because there are more individuals, more applicants attempting to upload their applications at the same time. So if you start at 12 noon, your application could take up to 3 p.m. to upload. Before your organization can apply for a federal grant, there are several steps an organization must complete outside of grants.gov prior to submitting an application. An organization is an entity that submits grant applications on behalf of the group, such as a state government, nonprofit organization, or a private business. The authorized organizational representative, as we call it in AOR, must submit the application to grants.gov. The AOR, who will officially submit an application on behalf of the organization, must register with grants.gov for a username and password. The AOR is the individual named by the applicant/recipient organization who is authorized to act for the applicant/recipient and to assume the obligations imposed by federal laws, regulations, requirements, and conditions that apply to the grant applications or awards. The electronic signature of the individual who logs in and submits the application to grants.gov will automatically populate throughout the application. The electronic signature must match the AOR name on the SF 424. What is the grant or cooperative agreement? A grant or cooperative agreement is defined as a transfer of money, property, services, or anything of value to a recipient in order to accomplish a public purpose. The cooperative agreement is specifically for a public purpose through the support or stimulation that has been authorized by a federal statute or appropriation. Grants and cooperative agreements are used when the principal purpose, as said, is to provide assistance for the public good or benefit. Now I would like to turn it over to my colleague, Dominique Hodge.
Awarding agencies are substantially involved with cooperative agreement recipients, providing technical assistance, monitoring, and evaluating project performance. Cooperative agreements will be awarded with consideration to overall cost effectiveness of the applicant's implementation proposal, overall quality of the proposal and the ability to meet the project goals, and ability to demonstrate a sustainability plan. The amount of funding for each cooperative agreement award will depend on the individual recipient's need as demonstrated in its application submitted in response to this NOFO. Before your organization can apply for a federal grant, there are several steps an organization must complete prior to submitting an application through grants.gov. Once you form a legal entity with an employer identification number, you are ready to complete the registration steps. Obtain a DUNS number. You must also have a valid DUNS and Bradstreet number. Register with SAM. Ensure that you are registered with the SAM database in order to submit an application. I strongly encourage you to do this now as it takes upwards of 5 weeks to complete. Register with grants.gov. The process can take between 3 business days and 5 weeks, so please make sure to begin early. If you do not complete these steps by the submission deadline, you are unlikely to be allowed to submit an application. Contact the federal agency point of contact listed in the grant opportunity to discuss that agency's policy. All applications will be submitted through grants.gov. Please familiarize yourself with this website. If you go to the homepage, there is a menu at the top, and there are videos that will familiarize you if you are not currently familiar with that system. I also encourage you to watch those videos if you have not been on grants.gov in a while, because it has been updated in the last year. One of the videos mentioned earlier is Grants 101. That is a terrific overview of the grants process and how you can apply through the grants.gov system. I recommend that you review all the videos prior to submitting your application. I'd now like to turn it over to Haley Gutzmer from Partner Relations Group in the Office of Communications to help moderate the question and answer session. Haley.
Great, thank you, Dominique. And before we dive into the Q&A, I wanted to turn it over to Janice for a quick clarification on some page numbers in the NOFO.
So thanks to a couple of questions that we received, we understand that the project narrative and the budget narrative there's a discrepancy. So we just want to let you guys know that we did clarify that we uploaded a revised version of the NOFO. For the budget narrative, the page limit is 5, and for the project narrative, the page limit is 15. This is outlined on pages 23 and 73 of the NOFO. So just wanted to provide that clarification for everyone. Thank you.
Great, thank you, Janice. So the first question that we have here is, can you confirm whether grantees of the Healthy Kids 2019 program would be eligible for this funding opportunity?
Yes, absolutely.
All right, and the next question is it correct that the 500,000 to 1.5 million is the amount that will be awarded divided over the 3-year project period?
Yes, that is correct. It's over a 3-year period of performance.
All right, the next question is, will priority be given to applicants in a state that uses the federal exchange as opposed to a state-based exchange?
No, no preference. We still encourage you to apply if you have a state-based or, a federal.
All right, our next question is, will full funding be available during the 90-day planning period?
Yes, it will be.
All right, and another question, can you explain the process for multiple organizations or state agencies applying together in a cooperative agreement?
We talk about that in our NOFO for collaboratives on page 11. So I would encourage you to read that. We are only going to take one application from a collaborative. So, those people will need to sign a letter of commitment with you. So I would definitely take a look at that. It's under special considerations for applicants that represent collaborative efforts. And again, that's on page 11. That can provide you with some additional details on that.
All right, and another question, can funds be used for software?
I think so, but I'm going to defer to my colleagues in the Office of Acquisitions and Grants Management. Sharon or Dominique, do you want to address that question?
I believe it is based, it's going to be individually based. So it depends on what it's going to be used for. Those types of requests are going to have to be dealt with at the time of. I can't definitely say.
All right.
Thanks, Sharon.
Thank you, Sharon. The next question is, what data collection tools and reporting systems are being provided?
So we have a monthly reporting template that we will provide to grantees who are awarded. We do that on a monthly basis. We also have a report for grantees to complete every 6 months. We call it our semi-annual report. And those reports are uploaded to our grant support system called Grant Solutions. So once grantees have been awarded, we will have a webinar and walk through grantees on the required reporting.
Great, thank you, Janice. The next question, does spending have to be equal each year, or can more be spent in the first year to get established?
Dominique or Sharon, do you want to take that question?
No, you're only allowed to spend within your awarded amount the first year.
All right. The next question, would assisting a client with completing a paper new application or renewal and telling that client where to mail it count as an application submission?
Yeah, but we would want you to take that a little bit further. Like if you are taking the time to complete that application, we would actually want you to help submit that application so that you can also track it and so that you can also verify whether or not that application has been approved.
Thank you, Janice. Let's see. The next question, will there be any issues with billing for Medicaid, outstationing, and receiving the Healthy Kids funding?
I would need some additional clarification on that question. So could you provide us a little bit more context and send that question to our healthykids@cms.hhs.gov? I just want to make sure that I'm answering it correctly, and given the information that we have right now, it's not enough for me to address.
All right, let's see. The next question, are you allowed to have staff that are split between the Connecting Kids to Coverage budget and another grant, such as a Navigator grant?
Yes, but you'll have to track those amounts accordingly. And I'll defer to Dominique and or Sharon if they want to add more to that. But we do have a couple of grantees who have both a Healthy Kids grant and a Navigator grant.
You're correct.
Thank you, Sharon. The next question, can a health insurance company receive this grant to help with outreach and enrolling?
Depends on what type of entity you are. We are very specific in our statute about which entities can apply. So I would encourage you to look at pages 18 and 19 of the NOFO. If you fall into those categories, then you are eligible to apply. We're not doing for-profit organizations though, or international.
All right, the next question, can we include policy strategies to enroll more children, parents, and pregnant people, as well as direct outreach strategies?
Yes. Yeah.
All right, and in terms of project goals, are there a minimum requirement for the number of applications submitted, number enrolled, etc.?
No, we really are relying on you to tell us as an organization who you can reasonably enroll into Medicaid and CHIP. So that's going to be based on probably your staffing, the amount of money. You're going to be requesting the area that you're in. So it's really going to be up to you, but we don't have a minimum or a maximum.
And are the children of undocumented individuals eligible to enroll in CHIP?
Yes, yes, we have some states currently that offer the unborn population, offer coverage to the unborn population, and they are eligible to enroll in CHIP. If you need more details about that, then please send that question into our mailbox so that we can address it accordingly at healthykids@cms.hhs.gov.
And how many grants per state will be awarded?
We don't have a set limit per state. We anticipate issuing 36, and it could be all over the US, and the territories in DC are also included in that as well.
Great. Are current CMS Navigator organizations eligible to apply?
Yeah.
And can grantees utilize funding towards sub-grantees with Navigator organizations?
Yeah, yes, you can. You're going to have to clearly define that for us, especially when you're overseeing sub-grantees. But again, we don't want you what we call double dipping. So if you've already, you know, if an organization is already funded for navigators, and you're using that funding to enroll, you know, parents into the health exchange, we don't want you to be doing, you know, duplicate work. Really, this grant is targeted to, you know, the uninsured children. We're highlighting pregnant individuals now as an optional and parents. So just need to be mindful that you how you sparse out your budget and how you're doing your staffing. You need to keep them separate. The two grants are separate. They're not one and the same.
The next question, what type of relationship is necessary with a state Medicaid agency or state eligibility agency?
We would encourage you, a lot of our grantees have established relationships with their states in order to get data, like a data agreement and an MOU. We talk about that in the NOFO. We encourage you to work with your state Medicaid agency so that you are able to verify data that you're submitting to us as well. If you're unable to establish that relationship with the state Medicaid agency, we also talk about a way for you to do an alternate data collection, which is, you know, talking with the applicant to verify their enrollment, preferably through some type of written documentation they received to the state. A lot of our FQHCs or clinic-based grantees also have access to the state system electronically and are able to verify data as well. But we strongly encourage you to establish a relationship with the state Medicaid and or CHIP agency if you can.
Great. And the next question, will priority be given to states that are in the Medicaid coverage gap?
Not necessarily. We are going to look at all of the applications fairly. We're going to be looking at them geographically. We're going to be based on need. It's all going to be based, you know, outlined in our criteria in E1. So, you know, we just encourage, if you are in a Medicaid gap state, apply. It is going to be based on the review criteria that we have outlined.
All right, and are applicants held to enrollment in one state?
Typically, yes. If you are going to cross state lines, you're going to probably need to explain that to us and how you're going to establish that relationship, how you're going to verify your data. We haven't in the past have had grantees cross state lines. It's not to say that we wouldn't approve something like that, but it's not something we normally have. So you would just need to explain that to us in a little bit more detail.
The next question is the priority on new enrollment or renewal?
The priority is any enrollment, new, renewal. We want to keep our children and our parents, pregnant individuals in coverage. We also really want to reach that 4 million that are hard to reach out there as well. So all enrollments.
Great. And will preference be given to projects that aim to enroll target populations versus aiming to provide renewal services? I guess that builds on the previous question.
Yeah, it's really focused on enrolling children, whether you're doing new enrollments or renewals. We want to keep children and families. We want them to get coverage and we want them to stay covered.
All right. And can a local government awardee subgrant to a community partner to take on a portion of the project?
Yes. Mm-hmm. You can have subgrantees.
And can a single entity apply on its own without forming a collaborative application?
Yes.
All right. And can you please share the page where it's stated that the project director must have 50% effort?
Let's see. That is in the NOFO. That was a section that my colleague Dietrich covered. Hold on just a minute. I'll see if I can find it for you all. If not, we can definitely, if you send the question, but it is in there. It's under the planning.
That would be on page 34 of the NOFO.
Great. Thanks, Dietrich.
You're welcome.
Thank you, Dietrich. All right, the next question, would nonprofit hospitals be eligible for this grant that has a Navigator program?
Yes, I believe they're an eligible entity on pages 18 and 19. Yeah.
And for a collaborative proposal, does the submitting organization have a greater responsibility or role than others in the collaborative?
Yes, because they are the lead agency.
All right, last question.
Okay.
Let's see, are organizations that receive indirect consideration from insurers eligible for this funding?
I'm not understanding that question completely. So if you could send that to our mailbox, that would be really helpful. I just would need a little bit more detail about what you're specifically asking.
Okay, great. Thank you, Janice. And thank you to everyone for submitting so many great question and answers. Unfortunately, we didn't have time to answer everyone's question, but there will be frequently asked questions that are posted for the NOFO on the InsureKidsNow.gov website. So most of those questions should be covered when that's posted. So now I will pass it back to Meg for some closing remarks.
Thanks so much, Haley. And I want to thank all of you again for attending today's call. We really appreciate your interest in the Healthy Kids 2020 funding opportunity, and we look forward to a robust applicant pool this year. As mentioned at the beginning of the call, any questions following today's session can be sent to healthykids@cms.hhs.gov. Thank you, and this concludes our call for today.
Thanks, everyone.